There are also differences in treatment of men and women with disabilities, both in social settings and in terms of medical treatment. When looking at disability with the lens of gender, women with disabilities are typically seen as more passive and helpless than their able bodied counterparts, while men are shown as having a corrupted masculinity because of their dependence on others. This is because women are considered deformed men, so disability is seen as more passive and feminine. People with disabilities are seen as less desirable because they're seen as having little financial worth, which is also a trait associated with being a woman. And this causes medical therapies to focus on increased productivity, where outcomes can look different between men and women. This means that a woman with the same disabilities as a man is seen as less desirable and less productive, simply because her gender also plays a role in her worth. Once out of rehabilitation, this results in disabled men with the same abilities as disabled females being preferentially hired. And this leads to women with disabilities being less likely to be financially independent or to hold the same rank as disabled men, because men with disabilities can still label themselves as men, which has higher social and financial rankings than being a female. Many of the rehabilitation programs also cater to the needs of men only and focus on cultivating competitive attitudes and reinforcing stereotypes of masculinity, and such as ensuring that men can perform sexually. This pushes aside the concerns of women with disabilities, emphasizing common traits such as passiveness and helplessness. Additionally, doctors can play a huge impact in the lives of people with disabilities, and gender influences the treatment that they get. One study showed that doctors saw men with chronic pain as brave and stoic, while women with chronic pain were seen as emotional or hysterical. And doctors treated their conditions as mental health conditions, not physical disabilities. The lack of belief in women's symptoms leads to 72% of women experiencing longer diagnosis times, which often takes years for women, and as well, they receive inadequate treatment because their pain level is not believed. I personally have had experiences with this. In high school, I had episodes where when writing at tall desks, I would lose the ability to control my hands, arms, and neck around, and this could happen 3 times a day, and could result in me passing out. ER technicians told my parents that they thought that I was on drugs with no proof of this. I was definitely not using drugs, and for years, my many male doctors told me that it was all just a symptom of anxiety. When I finally had a female doctor, although I did not see her because of these episodes, she did testing and told me that I have vascular thoracic outlet syndrome, which cuts off the blood flow to my extremities when I lift my arms past a certain point. For years, doctors gaslit me and told me my symptoms were all in my head, and this impacted my mental health so much that I considered suicide very, very much, it was a horrendous experience. This was all because I had no answers and life felt hopeless. Similarly, my mother, who was in a car accident and was left with several herniated discs, had doctors not believe her when she said she could not feel or move her legs, and delayed treatment for several months because they thought she wanted pain pills. Doctors need to realize that their bias does exist and it does cause harm to women with disabilities. This bias can stem from societal conditioning or from inequalities in medical research. Because women have menstrual cycles and become pregnant, potentially, scientists view them as inadequate research subjects because of fear of causing reproductive issues and hormones impacting the studies. Most studies only involve men, and they tend to be white men. Introducing medical treatments or diagnoses criteria that only represent white men, which ignores differences in Black, Indigenous, people of color, and women. Women also have different metabolisms, and differences between female and male bodies can result in differences in how disorders present and how treatments and drugs impact women. This can lead to increased rates of female patients dying, for example, from heart attacks, where medical information on how heart attacks impact women is not really circulated. This also leaves intersex and trans individuals out of studies and gives limited knowledge on how drugs and therapies work on their bodies. One study showed that 50% of transgender patients had to teach their doctor how to medically care for them. All of these factors make medical prognoses for women's worse and reinforces passiveness in females, showing the huge impact that gender has on individuals with disabilities' lives.